Hello, everybody. This is Dr. Kamel again, and a new content related to the physical therapy license exams preparation. If you didn't see any of my videos before, my name is Dr. Kamel. I'm working as associate professor of physical therapy in the United States, and I'm a licensed physical therapist across several states in the US, also in the UK and in Egypt. I have got my PhD from University of Nottingham in the UK. So let's go for today's content and see what will we be discussing today. A physical therapist working in a home health setting is treating a patient with diabetes mellitus. We know, in healthcare, we have different settings. We have outpatient physical therapy, we have inpatient physical therapy, we have home health, we have nursing homes, we have rehab facilities, so different types. But this is in home health and patient with diabetes mellitus. During the visit, the patient reports that he is no longer taking his prescribed insulin. This is non-compliance with medication. So the patient is not taking medication. Why? We need to know why the patient is not taking his prescribed insulin. And it is essential for the patient for blood sugar to be under control to take the prescribed insulin. What should be the physical therapist's first action? A. Instruct the patient in the proper technique for insulin injection. Contact the patient's home health nurse. Tell the patient's family to report this information to the physician. Have the patient perform a urine glucose test during the visit. Okay, so what should be the answer? Contact the patient's home health nurse. Okay. You know, there is no point in instruct the patient in proper technique for insulin injection and you don't know why the patient is not compliant, why the patient is not taking medication anyway. Asking the family to report that to the physician, okay, but you need to do something as well. You cannot just transfer the thing to the family, asking them to report this information, and you will not be doing anything. Perform a urine glucose test for sure. It might be high, so what is the point? So we are in home healthcare setting. We are working in interdisciplinary team. Mean there are different healthcare workers. They are collaborating together in order to, give the best and the optimum treatment and management for patients. So this interdisciplinary team might include physicians, home physicians, nurses, physical therapists, occupational therapists, social worker, and other people as well. Okay. So when you have a patient, as in this question, reports stopping a prescribed medication and is essential medication like insulin, we need it is a significant medical concern. Okay, and must be communicated immediately to the appropriate healthcare professional. Usually the nurse is visiting the patient once a week, so you need to call the nurse. Hello, I have patient blah blah blah, date of birth, address, and this patient report told me today that he is not taking his prescribed insulin. Okay, so when you are telling the home health nurse about this situation, the home health nurse actually is responsible for medication management, monitoring blood glucose, and also coordinating and communicating with the physician regarding any updates on the case or medications, stuff like that. So this will be my first point of contact. I will contact the home health nurse and and inform her or inform him about this situation, and then they will assess the situation and see if they are aware with this information or they are not aware of what is going on, and then they will assess the situation and contact the physician if necessary. Okay. Sometimes there are some obstacles. The patient, cannot afford to pay the co-payment, for example, for medications. The patient hate to inject the insulin. We should, we need to find out. Okay, so you will write this under communication section that you have communicated with the nurse on that day, on that address. And actually, this is one of the main things which we are doing in home health, like proper interdisciplinary communication. And this will follow the scope of practice as well. Okay. Let's look at the incorrect options. Instruct the patient in the proper technique of insulin injection. It is outside the BT primary scope of practice in this situation. Okay, and medication non-compliance, mainly in this situation, and so it is not the injection technique, it is actually medication non-compliance. So the nurse should be addressed about this situation. Tell the patient family to report the information. It is indirect, inappropriate, and this means that you didn't do your work. So you should communicate as a health care worker or provider, communicate this information directly to the care team, not to rely on family members to do that. Have the patient perform urine glucose test. This does not address the primary problem. The primary problem is medication non-compliance, or discontinuation of this prescribed insulin therapy. Okay. So if you see a question, and for exam clinical tip regarding home health, what should be the sequence? Number one, communicate with the interdisciplinary team regarding this specific problem. Stay within your scope of practice as a physical therapist. Number three, address safety and medical compliance first. Okay, so again, when patient stops a prescribed medication, the best first step is to notify the appropriate healthcare professional responsible for medication management, usually the nurse or the physician. Okay, this was a question for today. If you would like to join my BT license exam preparation course, please send me a WhatsApp message on 001442 248 7206 or 00201027743702, and I will send you all the necessary information how to join the course. Also, if you would like to apply and join the transitional or post-professional DBT program at University of Montana at a discounted rate, we can do that and can help you to be admitted to this online program. We have people who have joined the program and graduated since 2019. So already 6 years now, we are helping people to be admitted to this this US and international program. Thank you for following me. Please subscribe to the channel, and I will be grateful if you can ask and share the link for my YouTube channel with your colleagues as well. And see you in a new content.